This conference will now be recorded.
I meant to hit that at the beginning. So, does anyone want to share from the health center perspective if you are seeing referrals come from OSU, or if you're getting patients referred to you for MAT? Are you aware of that? Does anyone want to share kind of how things are going?
Tiffany, I can go just from a Southeast perspective because unless I'm missing it, I don't believe anybody else from Southeast is on the call. So to my knowledge, we have not gotten any official referrals through the process. We are certainly seeing an uptick in walk-ins for our Bridge to Opiate Recovery program, which happens on Wednesday afternoons and Thursday afternoons.
Thanks, Dr. Dana. I don't see anybody from Southeast on, and I know that Karen couldn't join us from Lower Lights as she normally has kind of an update, but does anybody else have Primary One or Faith Mission? Are you guys seeing any?
Hello, this is Stacy from Primary One Health. Kelly just let me know that we have not had any referrals. She said possibly one, but she would need to follow up and see if that was the case, but she doesn't think so. And we are not seeing an uptick in walk-ins.
Okay.
But we are staying busy otherwise, definitely.
And I don't know if Allie's still with us, but Haley, I see that you've joined us. Do you want to share anything from the OSU side in terms of what patients' needs are looking like right now, and if you guys have used that MAT referral sheet?
So I was just asked to sit in on this meeting, so I apologize that I don't know a lot of information at the time. I have not used the MAT referral sheet yet, nor do I honestly know where it's at. Is this something that was given to Dr. Kaufman?
Yeah, so I can pull it up. Basically,
yeah, that would be amazing.
Yeah, and give you some background. Sorry, I didn't mean to put you on the spot. I thought you meant.
No, you're fine.
So this
is Allie. Sorry,
oh, go ahead.
I lost my power temporarily, so I'm now back on the phone. I just wanted to add, so thank you, Haley, for joining the meeting. It was sent to Dr. Kaufman, and then we had, there was like a lot of turnover for social work in the emergency department, so I wouldn't be surprised if it got lost.
Okay.
So yeah, that's just what I wanted to say, so I don't feel bad.
Well, I'm happy to help. Just bring me up to speed.
Sure. So this meeting has kind of been convened around the idea that FQHCs have availability and opening for MAT patients, and that there is probably a certain number of patients that you guys are seeing in the ED that then you would discharge and say, hey, there are these MAT programs going on in Franklin County. These are their locations. You can either help the patient get scheduled or show them the information. And sorry, I'm trying to multitask at the same time to pull up the sheet that I'm referring to. But basically, we had the health centers and Dr. Kaufman helped kind of all work together on creating this 1-pager or 1.5 pager. And unfortunately, it lives on paper. But with all of the resources that you would need to make a patient referral. And I'm just going to pause for a second while I find the document. We have several different versions, so I want to make sure. I think the latest version was updated at the end of 2020, and I'm pulling it up right now. And so health centers have made a few changes to this over time, and we've kind of kept these referrals meeting on. I was starting to say before Allie chimed in, as part of our goals with the overdose data to action grant in strategy 7, that linkage to care. So keeping Franklin County sort of health systems working together. And so you can see each health center has listed their information, contact information, how to get an appointment for MAT services, if they're accepting primary care patients, if you're doing a bridge script for that patient as they leave the medical center, how many days approximately would the health center prefer in order to get the new script written by the new MAT provider for the outpatient care at the health center. And then any additional things that the health center can provide to that patient. And so we have put this together, and we've also worked to include the REACT information. And then we have started slowly to get this information on relink.org. That was something that Dr. Kaufman felt would be helpful in the beginning. And so we finally made the connection to get some of the health centers on, and that was going to be another follow-up question I was going to ask of the FQHCs, if they've seen any changes because of the information being on Relink, or if they're not able to track that.
Yeah, this looks great. I have not seen this. Doesn't mean it's not deep in our files somewhere, but I would like to get my hands on this so I can print it out. I do need the contact info updated. My name is also Haley, but not Haley Bowra. So if you can,
Okay.
yeah, put my last name in there so people aren't confused.
Is Megan still the inpatient STD?
She is, yep.
Cool. So I'll follow up with you, Haley, afterwards via email and get your updated contact info, and then I can send this out to you as well as everybody else with the new information below.
Great, thank you.
Sure. So I guess without much of the team here, I don't know if anyone wants to proceed or has anything that they want to discuss. We can certainly schedule a future meeting and try to accommodate Dr. Kaufman and the addiction patient clinic provider that Allie was talking about before.
Yeah, and I apologize if I was supposed to invite like the inpatient social worker, Megan, because that would be a good idea. We also have a system-wide care coordinator starting, one of two. The first one is starting in about a week. And so I think it would be good for her to also meet with you all. So I think that would be a good next step to kind of get them all, and then we can invite Dr. Wynn from the primary care side as well. It's kind of as you can see, or as you can hear, like we have all these different points in our system, and that's why we are hiring this system-wide care coordinator. So she will be referring between our inpatient and outpatient sites, but obviously that doesn't always work for every patient. So like we'll often have to refer to other community sites. So I think that would be good and allow us to kind of expand this conversation beyond the emergency department, because there are a lot of patients in the emergency department, but linkage from the ED is like a perpetual challenge, probably forever. And so I think actually we could get more referrals from our other sites and see that happen a little more quickly.
Sure. Yeah, and Allie, I would just say, like, please feel free to forward these invites to anyone on your team. I know some of your staff have changed over, so I'm sure my lists are always out of date since we're kind of setting these meetings quarterly right now. And like I said, had canceled the last one, but feel free to forward. This is really open. It's certainly not a closed meeting by any means. It's kind of just to coordinate whatever we can in Franklin County and sort of meet those goals of the project. We've started out with just working with OSU. I think we had the vision and idea to include some other hospital systems, but I feel like we haven't nailed down a good solution for the work between the FQHCs and OSU yet. And I want to be comfortable, or I guess make sure our process works to some extent before we do so. But open to anyone's feedback on that.
Tiffany,
Yeah, I think that's,
I was just going to
go
say, I'll
ahead.
give feedback, at least from the Southeast MAT and BOR program standpoint. Yes, we would love to work with all hospital systems, but it would be great to know that we have a process that sort of meets the objective and that we're getting some traction with OSU.
Mm-hmm. Yeah, thanks, Dr. Dana. Go ahead, Allie.
Oh, I agree. I don't know. I don't have a good sense of what the other hospital systems are doing, if they have like staff that could attend, and I don't know, maybe Haley, you know this, or anyone else, like, is Relink being utilized in the ED or in the community?
You said Relink?
Yeah, relink.org.
That I don't know.
Looks like this. So
Oh, yeah.
we had heard to add health centers, and all of the FQHCs were like, yeah, put our MAT details sheet on here. So it lives on here as well.
Okay.
And again, this was part of the overdose data to action grant. It was a pretty simple connection that I made with someone during a meeting that then was able to help me get the details sheet that I just had up on here. So if you search Franklin, you can find some, but not all are listed.
Honestly, the barrier we face here in the ER is that many of our patients don't have a phone, especially ones that are like going to treatment for whatever reason. Their phone is dead, or they have lost it, or they don't have money to pay for it, or just things like that. So I don't know how well this would be utilized. I think it's great for certain populations, but the people that we're seeing, they're not exactly information or technology literate, or they have the issue with the phone.
Yeah, I think this is Dana again. I could be misunderstanding, but I think the purpose of the Relink tool is to assist you all in providing like a phone number and or address and or appointment to the patient while we're interfacing with them. And that certainly is also the intent of the process and referral form and mechanism that we work together with you all to create.
Yeah, that would be great. I could pull this up in the room and, kind of gauge where they're at and see what they're thinking in terms of location. We also have like paper resource sheets that we keep updated, so we grab those sometimes as well. But I can share this with my colleagues and have them start using it as a resource, just interactive with the patient as well.
So the resource sheet, the FQHC resource sheet, has some specific instructions about when the patient can show up or walk in, and or specific contact information for the patient to leave your encounter at the hospital with. Or if you want, like it's Monday through Friday business hours and you want to reach out and help them make that appointment, it also provides the ability to do that.
Yeah, I think the simplest form that we all could come up with in previous meetings was the walk-ins, in terms of a patient maybe not having a phone or being able to make the appointment themselves if you aren't able to make it for them. But Yeah, I will definitely get this sheet to you, and feel free to look at the relink sheet as well. It's most of the information that's on here is also on there, but I think
Okay.
some of this instruction is not on the website. It's pretty
Perfect.
specific to the work that we've all been doing as a group here.
Okay, I appreciate that. We'll definitely utilize it. If you can send it my way, I'll make sure it's available to the providers and to the social workers here.
Great. Well, I think it sounds like we want to follow up with the larger group and hopefully get some of the additional outpatient areas of OSU involved, which I think was our goal back in January. It hasn't come to fruition quite yet, but I will do my best again with a doodle poll and with all of the contacts that I currently have. But feel free to help me out and forward the doodle poll to anybody else that you think would be a good fit for this group to join us, even if it's just for one meeting to give some feedback. We think it would be helpful.
I will do that and make sure we have everyone from OSU.
Okay. All right. Well, thank you, everybody. Sorry it was a relatively short meeting today, but hopefully we can get some traction with the larger group back here again soon.
Thank you.
Thanks. Have a good
Thank
day.
you, Tiffany.
Thank you.
Have a good weekend.
You
You
too.
too. Bye.